Hi, everyone. I'm Matt Henney with Project Q Atlanta. Welcome to another episode of Q Conversations, our Friday live event series about LGBTQ issues. We're here today on this World AIDS Day to talk healthcare and sort through your options with the Affordable Care Act. There's 2 weeks left until the December 15th deadline to find a health insurance plan for 2021, which means that 2020 is finally going to end sometime, which is great. So we partnered with our friends today at AbsoluteCare Medical Center Pharmacy for today's event and are joined by two of their experts who have years of experience navigating people through open enrollment. But first, I want to introduce Jordan Cook, who is a community engagement specialist at AbsoluteCare, to say a few words about the practice. Hey, Jordan.
Hey, Matt, thanks for having me and thanks for having all of us. Just wanted to welcome everybody. You're going to get some good nuggets from Amir and Angel later, who I both work with at AbsoluteCare. Amir's been helping us with open enrollment. Angel is a licensed social worker who's also been helping folks with all of those things, including open enrollment. And at AbsoluteCare Medical Center and Pharmacy, we're a primary care and infectious disease center who offers gender-affirming care, amongst a number of other wraparound services. As you can see, we've got social work as one of those, and we do help with the open enrollment. So if you're looking for a new LGBTQ-friendly provider, give us a call, 404-231-4431. I hope you guys enjoy.
Thank you. Let's see. All right. And for today's event, we are joined by Amir Jones, a certified application counselor, and Angel Robinson, a social worker, both from AbsoluteCare. Hi, everyone. Thanks for joining us today.
Hello. Good afternoon.
Hello.
Thanks for having us.
Absolutely.
And then we also are joined by Project Q's Mike Fleming, who is moderating the online chat, which is on your screen to your right. And drop your comments in there during the event. And if you have questions for Angel or Amir, please put those in the Ask a Question feature, which is at the bottom of your screen, and we'll be answering those during the event. So with that, we will get started. Okay, Amir and Angel, let's sort of set the table on what we're talking about today. I'm sure people see news headlines about the Affordable Care Act and healthcare.gov and the ACA being challenged in court. So can you all sort of give us a little primer on what is the Affordable Care Act and what makes it special? Is there some basic vocabulary that we should know?
Sure thing. I'll get started and get the ball rolling. So over the years, there have been legislation to question or parcel apart what the ACA is and what it has to offer. So know that for those that are listening now or will see the recording at a later point, the Affordable Care Act is the law of the land. And so it is still in effect and it is still available for accessing coverage. What makes the ACA special in particular is the fact that you can receive a subsidy to help pay for your monthly premium. Excuse me. So folks are able to still access health insurance by way of their significant other or through a job or staying on their parents' plan to a certain extent during open enrollment. However, the healthcare.gov platform is the only place in which a subsidy could be garnered. And I also think what makes the ACA special was if we think about the spirit of the law and what President Obama at the time was looking to do, he was trying to make health insurance accessible and to demystify, if you will, the actual process of purchasing health insurance. Back when the law took effect and rolled out, every state had its choice as to how they would actually participate in that process. And so there are state-based exchange, much like California and New York and other states. There are states that use the federal government site and the larger national platform, and Georgia is one of those states, as well as a hybrid, meaning both of those, a mix of a state-based exchange as well as the federal government's exchange. So in that respect, our state didn't necessarily use a state-based exchange, however, that could change. But again, in thinking about the spirit of the law, Obama really wanted it to be something that made it clear and easy to understand terms, provide people with access that may or may not have had access before, as well as to really see how to piece apart how we value our healthcare and look at healthcare. So those are a couple of things, in my opinion, that makes it special.
Okay. Angel, anything you want to throw in there?
Yeah, just to kind of piggyback off what Abir's already said, the ACA gives opportunity for those people that may be self-employed or may not have employer coverages, and it just gives the opportunity to us to opt into subsidies that can ultimately make it more affordable so that we can have some insurance coverage.
Okay. And then what about healthcare.gov? That's essentially the website that, I think you touched on a little bit, but can you talk a little bit about what that is and what role that plays?
Sure thing. So there are three ways that a person could apply for health insurance. They can do it over the phone, they could do it online, or they could submit a paper application. So the idea behind the website is that you can compare in real time what your options would be upon the completion of an application. And that is another feature of the website that makes it special and that also makes it unique. So once an account is created, i.e., having a username and password, you're able to look at plans before you make a decision during open enrollment for what is a good fit for you or for your family. I like the fact that you can see things in real time. So it's not a matter of getting something in the mail or waiting till a representative can populate the information. You can see it pretty quickly what is a possibility. There's also on the website an opportunity to look at plans before you apply. There's what's called an estimator tool, and that tool gives you the ability to see based on a couple of criteria, amongst them the income, family household size, and age, whether or not you're eligible for a subsidy before you actually complete an application.
Right, and that's I've used it in past years. That's what I love is that you can on the website you can compare plans as well, and you can get an idea of what your options are as you're working through the process. So what are essential health benefits, and what role do they play in all of this? Who wants to talk about that?
Well, I was going to start, but Phil, go ahead and share your thoughts on it, Angel, just so that I'm not the one talking for the entire time.
That's absolutely fine. Just because I feel like a lot of what my role is I'm not as I don't want to say I'm like not as versed in the terminologies of things, but basically we heavily rely on the estimator piece because what our role is at Absolute Care is for patients that do opt into the ACA or have lost coverage of any sort. We utilize that basically to try to identify best plans for them. So the verbiage wise, you can absolutely take it away because I'll be back on the other end.
Fair enough. I didn't want to take up too much space necessarily. So essential health benefits, which is actually back to the initial question about what makes the ACA special, essential health benefits are categories in which every plan on the exchange has to cover, which is very much about its preventative screenings, emergency room care, et cetera, et cetera. And so again, when we think about the law and the spirit of the law, what was hoped was no matter which plan you picked, there was a certain baseline of coverage. There was a certain parameter in which every single insurance provider, be it Kaiser, Blue Cross Blue Shield, Humana, et cetera, if that insurance provider was going to be on the exchange, they had to meet very specific requirements. And so essential health benefits is a part of that and speaks to that. Prior to the ACA taking effect, there were all sorts of restrictions and unfortunately parameters in which some people didn't qualify for care, in the sense that, as an example, taking a medical history, providing all the information about pre-existing conditions. That doesn't have to be done anymore through the exchange and through that law. And essential health benefits lets you know, again in real time, what you might be eligible for and what the cost of certain services might be when you're thinking about your budget and your bottom line for you or for your family.
Okay. That was a follow-up about essential health benefits. How do those impact queer and trans folks and people living with HIV?
I would say it's twofold. For one, with queer and trans folks, there is a law, that's a provision in the exchange, which is called Section 1557, which I can talk about in more detail in a little bit. But Section 1557 protects folks from discrimination based upon sexual orientation and gender identity and expression as it relates to purchasing health insurance. But back to your question about essential health benefits, I think what's great about it and what is notable for the communities that you mentioned is that you are going to be able to receive fair, impartial, and respectful care just like your heterosexual counterparts would or would not. And in that regard, you know that how you're treated, what the cost of your medications are, it's not going to vary or change based upon your heterosexual counterparts. Meaning the essential health benefits that are available, they're available to everyone that purchases that plan or looks at that health insurance coverage. I think I'll also put in here too, which also speaks to the question that for people that are queer and trans or living with or are impacted by HIV, they're able to see and note what the cost of their medications are, if their doctors are in network or not, and as well as see someone such as myself, a certified application counselor or a navigator, to walk them through the process and be given all the respect and dignity that they deserve.
Okay, great. And I should have asked you this at the start of things, both of you. You can just kind of basically describe your roles and what you do at AbsoluteCare as it relates to the ACA and insurance.
Okay, so I'm a licensed social worker, and pretty much at AbsoluteCare, my role is to basically, I say always be a mediator to ensure that the patient's able to obtain medical services from prescriptions. Sometimes I get involved in referrals just to ensure the continuity of care. And so when it comes to insurance based, sometimes, especially in the current COVID scenario that we're in, people may have lost insurance, may have been furloughed, and various things that ultimately impact their ability to obtain their medication or even insurance. So with the ACA right now, they're in open enrollment. Myself and Bethany Weichert, she's also a part of our social service team. It's just me and her at AbsoluteCare outside of Amir. We're happy to have every time he comes. So basically, we're basically going through an enrollment process to identify what subsidies they may be eligible for, as well as identifying those people that may be able to obtain insurance, further insurance assistance in the community.
Okay. And Amir, what about you?
So I, excuse me, I am a certified application counselor. And so when we think about health insurance, typically folks think of agents or brokers or are more familiar with those individuals. And so in my role, I talk to people about the law. I answer questions about the application. I also guide them through what their options may be as it relates to coverage. So I referenced agents and brokers before. And so know that if someone is working in this field, I certified application counselor or a navigator or a licensed broker, they are connected to the Georgia Department of Insurance. And I bring that up because there are limited coverage plans and other plans that folks may have heard about that aren't on the exchange. And I think it's important to know that we're licensed by the state to do what we do. And we also, as certified application counselors and navigators, we are not charging a commission for our services. All of what we do is free of charge. And to me, the spirit of that means that you're not necessarily being pushed in one direction or another as it relates to health insurance. Whereas before, with agents and brokers, they tend to know about one particular insurance product. Our role is to help folks figure out, here's your medical needs, here's what your dependents or your significant other needs, and how can we best find a plan that will meet those specific needs. So that is what I do and what my role is in the process as it relates to being a CAC.
And so when people come to you or to other certified folks, they don't have to worry about being directed or pushed towards a particular plan that may or may not be
right
under the ACA and that sort of thing, right?
Yes, absolutely. And I often share with people, if they're pausing or hesitant about a plan, that they don't have to pick it today, meaning that open enrollment is from November 1st through December 15th. So there's an opportunity to do additional research or to recrunch the numbers, if you will, and thinking about your family's budget. But again, I am not charged, or I'm not accepting a commission for my services. And I think that's important to know too when we think about how are we going to compare side by side two different plans, or how do we figure out if your doctor is in network, as another example. So that part of the work I think is important, and it also can be more robust with a navigator, agent, or broker. And that's not, I'm sorry, a navigator or CAC. That's not to say that an agent or broker isn't competent or able to provide other info. They tend to think about one insurance product.
Right. Well, and here is a question from Mike in our audience, and they asked, what do the changes to policy signed by Brian Kemp and the Trump administration mean for the future of healthcare coverage in Georgia? There were a few waivers, I think, that Georgia applied for that were recently approved by the Trump administration and federal regulators. So can you touch on what those might mean? And is there an immediate impact, or is this something, those changes, are those things that are down the road?
Well, let me say as a caveat that navigators and certified application counselors are not political or not biased necessarily in one way or another when it comes to helping people understand and look at the law. What I can say is that it is a partial Medicaid expansion. It's not a full Medicaid expansion for our state, unfortunately. So I would direct people either in the chat or after this conversation happens, I can direct people to other advocacy groups and organizations that are working on creating the parameters for a full Medicaid expansion. There's organizations such as Cover Georgia, Georgia Equality, as well as Georgians for a Healthy Future that are working and have been working since the very first year of open enrollment to make it as affordable and as accessible to all Georgians. So yeah, there's not an immediate change as far as this year's open enrollment is concerned. But again, I probably should reserve my 2 cents, which I'm more than happy to give outside of this conversation, and over a coffee. So yeah.
Thank you. Oh, I'm sure we all have our opinions. That's a whole different event there.
Absolutely. Yeah.
So who's a good fit for healthcare.gov? Who should be using that to find their health insurance?
That's a great question. I would say that everyone is a good fit in the sense of you can look at the options before you apply, and it never hurts to look. And in the sense of maybe you currently have health insurance coverage and you know that the premium is going to go up if you re-enroll. It's a good opportunity to check things out. If you've moved, if you've had another life change, such as an addition to your family, that's an opportunity to look and see what's available on healthcare.gov. I will say in terms of the subsidies, there's 2 types. You have the premium tax credit and you also have a cost sharing reduction. So if you're eligible for both of those, that could mean a significant amount of savings on the cost of your monthly premium. And I should also mention, you had asked about terms we should know or terms to talk about. The marketplace has a glossary on the website. And so if you didn't remember after meeting with me or another enrollment assessor, maybe you forgot what a deductible was, or you want to clarify on what an out-of-pocket max is, you can just put it in the search. It'll pull up, or you can put the alphabet and skim the different terms and ideas there, and then you'll have a little bit more context. But again, as far as applying is concerned, there's no charge for doing so. There's no charge for looking at the estimator page. And I think it's always helpful if you know that your budget is fixed, as it is for many of us. Seeing what's available, it is never a bad idea. Open enrollment is from November 1st through December 15th. However, there is what's called a special enrollment period. So some people will have what's called by the marketplace a qualifying life event, as I mentioned, with those changes of, in addition to your family or moving from one state to the next, or having an income change, that sort of thing. So if there's a qualifying life event, you can purchase health insurance outside of open enrollment. And again, comparing your choices is never a bad thing. For many of us, unfortunately, we've had changes and shifts due to the pandemic. And that means for some people, unemployment benefits. And so that would also trigger potentially a special enrollment. And that could also give you an option of health insurance coverage outside of COBRA, should you have been offered that as well. So it's never a bad idea to just compare your options.
Right. Okay. And Angel, we're facing a deadline, right? 2 weeks from today, as a matter of fact, December 15th.
Yes, we are closely approaching. So I know for myself and Bethany, it's kind of we're down to the wire. Definitely working long hours, just trying to make sure that anybody that calls in, we're able to connect with those people, we're able to get those consultations and those estimates together, and working partner with Amir to try to get them in for those people that may need assistance with further enrollment.
Mm-hmm. Yep. I would also add to that the website is open 24/7, especially during open enrollment. It can be tricky in that there might be a question that you're unclear about, or the website might be moving a little slow due to the high volume closer to December 15th. But know that if you begin that process, it can absolutely be saved and you can go forward from there. Um, as I mentioned, you can apply online or over the phone or with a paper application. And so let's say you want to do it at 10 o'clock at night and you hit a snag. You can call the marketplace and there will be someone there to pick up the phone and help and assist. Not to say that I wouldn't assist at 10 p.m., but I'm probably not going to be available. But again, know that as far as the deadline is coming, that those services are available 24/7 if there was a question or if there was an issue.
That's what I was going to ask him here. If I'm working on this at 2 o'clock in the morning and I'm stuck, I can't give you a call.
Well, it depends on how strong my coffee is. But no, my partner would absolutely attest that my bedtime is far earlier than that. So I'll be there in spirit.
Appreciate that. You'll be there in spirit, holding my hand through navigating
Absolutely.
healthcare.gov. I like that. So, what if somebody is uninsured and they're coming to this for the first time? Is it a different process? Are there impediments to it, or is it as straightforward for somebody without insurance as it is with somebody who is renewing a plan for next year?
Mm-hmm. I would say it's relatively straightforward in the sense of I've worked with people that have been on healthcare.gov and they are confused and frustrated and getting impatient with the application in the sense of they're not quite sure, should I say yes, should I say no, I don't understand how this is phrased. And that's where I step in, or a certified application counselor or another navigator. So whether you're uninsured or not, I don't think is necessarily the issue. I think the issue is what the computer literacy and computer comfort level folks have. And I would also say when you're uninsured, open enrollment is definitely the best time to take a look and to see what's available. The application itself is not going to ask if you're insured or not and put you in a different portal or put you in a different section, if you will. Again, when we think about the spirit of the law, Obama was trying to make it as accessible as possible.
Right.
And in the first couple of years, it went from November to January. So with our current that was about to get political, but given where we are right now, it is a shorter 6 weeks as opposed to the previous length of time. And I think that being under the gun and or pressure, if you will, can sometimes trip folks up in that process. But if you're uninsured and you just want to check things out, you absolutely can do that on the estimator page, which I could walk someone through, or Angel or Bethany could from AbsoluteCare as well.
Okay. Yeah, it's an interesting point about the deadline, because I didn't realize it was December 15th until we all started talking about planning the event, and I looked and was like, oh, I just assumed it was later. So it was a good reminder to me, because I actually used healthcare.gov as well. So it was a good reminder to pull together and start working on it. So, and that leads me to my next question. When I am pulling it together and getting focused on this, where do I start? What's the first step?
The first step is to create an account, if you haven't already done so. And if you have done so, updating your username and password, should you need to, is also the first step. I would say before that step happens, though, to think about a couple of things. The first is what medications you need, and whether they're generic or if they are requiring a prior authorization. I would also look at what your doctors are in network for, in the sense that for a lot of people, they've established a relationship with their doctor and they don't want to change. And if that is the case, that will probably filter in your search as it relates to what types of insurance products you're interested in. I would also suggest before completing an application as well to think about what your family and your individual needs are for the coming year. For instance, do you wear glasses and is your prescription in need of an update? You know, do you need to see the dentist and know that there's probably going to be some major surgery work that needs to happen, i.e. a root canal or something else? Hopefully it wouldn't, but that sort of thing. Those would be the ideas that I'd want to have a pretty good grip on, in the sense of knowing this is what I'm going to prioritize about my health. And even further, in a more philosophical direction, I care about myself such that I am going to invest in my health. We're here to talk about the ACA, but I also think we'd be remiss to not mention the fact that in the time of this pandemic, it's all the more important to take care of ourselves physically and otherwise. So, what you prioritize for the coming year can influence what health direction you want to go.
Well, I've been, go ahead, Angel.
Oh, I was going to also say, from more like a consultation perspective, for patients that we have in the office, when it gets around open enrollment period, a lot of times when we're getting those calls to schedule these appointments, it's really important to have your anticipated annual number. That is a huge part of what we do, because it kind of helps us, as Amir was saying, with the estimator tool. And if you don't have the complete 2020 number, that's absolutely okay. Let's just get as much of the income information as possible, so that when we're having that consultation, we can get as close to it as possible. That's the whole goal.
Okay. Interesting. Yeah. And you saying that, and Amir talking about unemployment and the high numbers of unemployment we've had during the pandemic made me think. I just was thinking, normally that's a income figure is a pretty easy number to come up with for a lot of folks, but being on unemployment might impact that, which would then, I guess, would that impact your eligibility or not for subsidies for 2021?
Yes, absolutely. Yeah.
Huh.
Go ahead, Angel.
I was going to say, it absolutely has the opportunity to. So I know some people I've worked with may have worked till February and then were furloughed, and they may have gotten unemployment up until this point. So for those individuals, we always look for that last stub from their prior employer, as well as that award letter, or even if, because we also know everybody's not getting their documentation that they should be getting from the unemployment offices and such. So we'll also go through, we'll calculate as much as we can. It's just bringing forth all the financial documents that we need to kind of assess and see what that number looks like.
Okay. Right.
I would also add on the subject of subsidies. So I referenced them, I believe, earlier in our talk. So there's a premium tax credit, and there's also a cost sharing reduction. And so if you are between 100% to 400% of the federal poverty level, you'll be eligible for a tax credit. If you are between 100 and 250 and you select a silver plan, then you would be eligible for a cost sharing reduction. So with the premium tax credit, it doesn't matter if you pick a bronze level, gold level, silver level plan, but with the cost sharing reduction, you will need to be between 1 and 250 and select a silver plan. From a numbers standpoint, let's use this as an example, and you can help me with the math, Angel, if I get it wrong. But
we're going to do math live. I like that.
So if you are a household of one and you're between 100 to 400% of the federal poverty level, that would mean, I think on the low end, 13,000 roughly, I think.
About 13, yeah.
Yeah, and then on the higher end, again, this is a household of one, a single non-married person, no dependents. So for 400, I think it's 49,000 for the year, I think. Something like that, maybe, or not that high.
I think it's a little bit lower.
Okay. Well, then we'll say, for the example, 13 on the low end. On the high end, we'll say 45 or 44,000 for the year. And so, as I'm sure folks would imagine, the closer you are to 400% of the federal poverty level, the lower your tax credit. Whereas if you're closer to the 100 side of things, the bigger or higher your potential tax credit would be. And again, if we're thinking about a household of one, for the cost sharing reduction, you're between 100% to 250% of the federal poverty level. So I believe that's 250 would be like 23, 22.
I was
Math
just
is not my
about
strong suit.
24.
Fair enough. 23. I'm not too far off. So again, between 13 to 23,000 for the year for a household of one, you'd be eligible for a cost sharing reduction should you decide to choose a silver plan.
Okay. Well, a quick question again from our audience. So this is about HIV. Does an HIV positive person have anything extra to think about when looking on healthcare.gov? Do some providers not cover certain meds or certain conditions?
Go ahead.
I would say from an HIV perspective, when we're doing that consultation, we're going to be making sure that whatever your current med list is, that's going to be covered through the prospective carrier that we're looking at. We also have, we look at, so that also plays a role in how we would select a plan in regards to or recommend a plan because it goes into the out-of-pocket and the deductible. We know that the antiviral medications could be on the higher tier of meds. So for us, a lot of times we will have the discussion around some alternative methods that we can utilize just to kind of offset the expense, but that does play a role, and we will look into that in the consultation.
Right. And yeah, so if somebody who has HIV meds and has a high deductible plan, I guess that is something definitely to factor in what that out of pocket amount is going to be, with the various options that they have.
Mm-hmm. I would also add with that that question that it's true for folks living with HIV as well as folks that just have medical conditions to know that every plan offers a drug formulary or a drug list, so you can see what tier you're at as far as what you're thinking about in terms of cost. So there's tiers 1 through 5 or 1 through 4. I believe it's 1 through 5. So again, the tier, if you're at 1, that means it's probably a generic medication name, and so it'll be cheaper. Whereas if you're at number 4 or number 5, that requires a prior authorization, i.e. the most expensive with all the bells and whistles medication, if you will. So in terms of budget, everyone can look and see before they pick a plan what the drug formulary has to say about the medications they're currently taking.
Good point. Thank you.
Mm-hmm.
For trans people, access to healthcare can be challenging. How can trans folks be sure that an insurance plan is for them? And are there ways for them to find gender-affirming providers that are covered by a plan? You all, I think, touched on this a little bit. And I know that in my experience with healthcare.gov, if you have a provider that you're already working with and comfortable with, there's a way to, I believe, on healthcare.gov, search for that provider and make sure they're covered within a plan. But more broadly, are there ways that trans folks can be sure that a plan is a good fit for them and that their needs are going to be addressed?
I would say the short answer is yes. I think the longer answer has to do with, again, what I mentioned about like priorities and needs as far as is your doctor in network, what are the meds you're taking, in the sense of for some trans-identified folks, they may or may not be at a point of doing a medical transition, or that might not be the best fit for them, or they may want certain sections of a medical transition that folks are typically aware of that may or may not be a fit for other folks. So in that respect, for folks that are on HRT or for the folks that are looking to add surgery to their gender affirming care, you can look up providers on the exchange. And I also reference section 1557, and that speaks to queer and trans folks in particular, because when we think about treatment and we think about potential discrimination or the potential harm of certain medical providers or institutions, that's really a buffer, if you will, for trans-identified folks and queer folks as well. As far as finding your provider, I would also add to that, knowing who is and who is not in network is important. And that's, again, something that you can look at on the exchange. Let's say, as an example, someone's living in, I don't know, Athens or Savannah. They're not living in the metro Atlanta area, and they want someone to give them in-person assistance, like a certified application counselor or a navigator. They should be providing gender affirming and gender supportive care, which again speaks to the section 1557 buffer, in that if anyone were to go in person to see or want assistance, they should be able to get it as it relates to figuring out how they could find support for their health insurance journey.
Then I was also going to add to that point that I would love to have a conversation, because just like Amir was saying, there's certain aspects just about where you are as a person, what things you're looking forward to doing, that we would need to have that deeper discussion. So it could vary person to person.
Okay. And that leads me to my next question. And that point sort of, it makes, I can certainly go on healthcare.gov now and fumble my way through it, but some of these questions and some of these issues that we've talked about, I mean, that's really where working with either of you really is beneficial, right? That to ask those questions, you can have those discussions and then kind of factor that in, whereas I may not have any idea that I could do that on my own, right?
Mm-hmm.
Absolutely. Then also kind of going back to what someone had mentioned in regards to being HIV positive, there's also the discussion of insurance premium assistance that is available. So a lot of times when we're working with someone that may fit their criteria, we also develop a plan of action so that we can make sure that they're able to benefit from that.
Mm-hmm.
Well, and so here's the big question for you: how can people get your help? How do people get to work with either one of y'all?
Look.
You first.
Okay. So for me, now you can definitely reach out. Like, there's various ways. If you call the main number and you're just like, hey, I'm interested in becoming a patient at Absolute Care. I'm not insured right now. Who can I talk to? The staff automatically knows. They triage all those questions to myself and Bethany. I do sometimes get calls where people just may have been referred by previous current patients or prior patients, and they're like, hey, I'm not a patient right now, but this is what I'm needing. Don't be discouraged by the fact of not being a patient, because we absolutely will still speak with you. We will still talk to you. We will still navigate you the route. It may not be as in depth in certain aspects, just for the obvious, being that the provider and such plays a role in how we manage or consult within our practice. But definitely, me, myself, and Bethany have definitely worked with people that are not patients as well, just to kind of get them connected to the right resource so that they can get what they're looking for.
Mm-hmm. I would also like to add with that I have been a part of a team of enrollment assisters for a number of years. And so if I don't have the answer or if I am not available, hopefully I can refer you to someone else that can or does have availability or may be able to best direct you to what the appropriate referral is. Again, I'm not up till 2 a.m., but I am, available all day during the working business week. So in that respect, if I don't know the answer or if I'm not able to assist right away, there are sets of colleagues that I have that are more than happy to assist should they be available as well.
Amir, do you need us to talk to your partner to get you extended hours?
Absolutely not.
With the deadline's in 2 weeks? No.
Well, hopefully she's not listening. But no, I'd rather not. Thank you.
I would like to touch and agree with that.
And with if folks reach out to you all through Absolute Care, your sessions are virtual, I'm assuming now because of our current situation?
Mm-hmm.
Yes.
Okay.
Yes.
All right. And then just quickly, people have a session scheduled with you or an application counselor anywhere. Are there some documents they need to have on hand to make the session be more productive and go more smoothly?
Yes. The short answer is yes. So you'll need proof of income. You'll also need, if not your social security card, but your social security number. And I say that because there's what's called the federal hub with the exchange, and it's the project that we're using. And so the Social Security Administration, Experian, Credit Bureau, IRS, as well as the Department of Health and Human Services, they're all a part of the hub, and they work in consort to make sure that people that are eligible for a subsidy it's actually going to the right person, i.e. verifying you are who you say you are. So in that regard, it's pretty much your general standard, any application, for the most part, information that you need. And if you are lawfully present as well here in the U.S. and in the state of Georgia, you'll also need to bring that naturalization card or whatever the appropriate card is for you that certifies that as well.
Okay. All right. And then one last question for both of you. Where can people follow you and stay on top of what you're working on and get in touch if they need to inquire about scheduling a session with you to get your help?
That sounds so official.
It really does.
I'm like, we could definitely you can definitely reach me at Absolute Care. On the direct number, I believe Jordan's put it in the chat, but it's 404-231-4431. Definitely let them know. I mean, you can either say I want to speak with social work, or you can definitely say Angel. Either way, they'll get to me. Also, email, I don't mind giving that. It is arobinson@AbsoluteCare.com. Shoot me an email. While I can't get into detail about any PHI or anything like that, but definitely we can start the discussion to get scheduled in so we can have that one-on-one appointment for sure.
Okay. Amir?
I would say that direct line that was provided is a good way to get in touch with me. I would also put my email address in the chat in just a second.
Okay.
I can do that too. I didn't think about that.
No problem at all. Well, as we bring our... Okay. Awesome. And as we bring things to a close, I want to thank everyone for taking part, and a big thank you to Amir and Angel and our partners at AbsoluteCare Medical Center and Pharmacy for making today's event possible. Thanks, everyone. And with it being World AIDS Day, be sure to take a moment to appreciate the memory of those that we have lost. And thanks, everyone, for joining us. Have a good day.
Thank you.
Thanks for having me. Have a good afternoon, y'all.